It's our top story. The Nigeria Center for Disease Control (NCDC) has put the total number of confirmed cases of COVID-19 in the country at 190, with 20 persons discharged and 2 deaths recorded. But according to the Lagos State government, following 4 newly released patients today, it brings the total number of persons discharged in Lagos to 23. Of the latest 4 cases, 3 are female, 1 male who tested negative twice. But at about 11 a.m. today, 6 new cases of the coronavirus was reported in Edo State, making it the 3rd highest after the FCT. Here's a look at the state-by-state breakdown of the cases, showing that Lagos has 98 cases, the FCT Abuja 38, Osun with 20 cases. Now, the Presidential Task Force has updated Nigerians on the ongoing work in curbing the spread of COVID-19. The Secretary to the Government of the Federation, Mr. Boss Mustafa, is appealing to Nigerians to comply with the stay-at-home directive from the government and, he says, allow security operatives to enforce compliance.
On no account should any Nigerian suffer any pain or loss as a result of this lockdown. So, with the compassionate heart of a father, the President desires that we take ownership of this to create the atmosphere that will enable the law enforcement agencies to work with us, to secure our people, to secure the health and the wealth of our nation. I think we've gotten to a point where we must truly be open about some of these things. You watch the news, you see in London, a temporary mortuary is being prepared. Not 1, not 2. What else do you want to know that this is a serious issue? That as a people, we must be conscious of that, and we must awake from our slumber and deal with this thing decisively and cooperate with government, cooperate with all those that have responsibilities of ensuring that we take the necessary steps. Or do we want to wait until we are confronted with those kind of situations? COVID-19 is not an ordinary virus. It has overtaken the world with a storm, whether you want to believe it or not. It has overrun even the best of medical facilities. You know it as good as I do. Our medical infrastructure is nowhere compared to the nations that are being driven aground as a result of this pandemic. And we still are casual about this. So it is your responsibility as the media people to drive a narrative that will cause every Nigerian to own this process.
For the Director General of the Nigeria Center for Disease Control, as they improve the capacity to test, he says testing must be done safely. Apart from the challenges of funds and infrastructure, Dr. Ihekwazu says the biggest restraint is human resource.
So thanks for those very good questions. Firstly, there's no testing of high-profile people going on. So we have to just clear the air on that. Earlier on, we had a slightly different case definition. We changed that case definition, and since then, everybody is adhering very strictly to that case definition. So we're not under any type of pressure to test anyone. We're doing, and everyone is following the case definition, and we have the full support of the PTF and the full support of the government of Nigeria. In terms of contact tracing, at the moment, cumulatively, we have identified about 6,700 contacts altogether. But remember, some of them have graduated out. So when you follow a contact for 14 days, he doesn't become ill. We graduate you out of the contact list. So at the moment, we've followed up on about 71% of that. That's actually the figure from yesterday. So at the end of the week, so by today, we'll do the analysis for this week and provide updated figures over the weekend. So that's really all the focus this week has been to improve our level of contact tracing, and the teams, particularly in Lagos, have really benefited from the quote-unquote lockdown. That has really enabled them to do this very difficult work. You all know how getting across Lagos is. So this has really become, it's like night and day, the difference between last week and this week in Lagos. So I know there's been a lot of pain among citizens, but please endure this for a few more days next week, and then we'll see how the situation unfolds.
Now, the Minister of Health, Dr. Osage Hanire, during the briefing said that investigations and contact tracing is ongoing, calling on all states to speed up efforts in curbing the spread of COVID-19. According to the minister, 18 specialists will arrive in Nigeria to assist in the ongoing containment efforts.
If all the social distancing and other measures are adhered to, the incidence of positive cases can be controlled. We have tested nearly 3,000 samples so far, and we are working hard to scale up our capacity in a targeted approach. Coronavirus Treatment Center Accreditation Committee was inaugurated yesterday by the Honourable Minister of State for Health and has begun developing an accreditation checklist as well as a protocol for management of isolation centers. We are compiling a list of trained workers in the health sector to man the centers as they become operational.
Joining us for more on the measures to curb COVID-19 is Dr. Josephine Okechukwu, Director, Public Health Department in the Federal Capital Territory. Thank you so much for joining us at this time. Please give us a sense of the impact of the lockdown in the FCT, considering that the FCT has the second highest number of cases there.
The FCT, in FCT, we have done such wonderful work. The effect of the lockdown is good, apart from the suburb where we still have some people that are not complying. But within the city center, it has been going on well. People are adhering and complying. It has helped us in the health sector to curb the cases of COVID-19. Many people call us, and we are testing so many patients, and few of them have come out to be positive. Luckily for us in FCT today, we did not have any positive case, as you can see from the national updates. The cases that we have were not from FCT. The lockdown has really helped in keeping people at home. This is just to contain the COVID virus infection, especially in terms of transmission, and for us to be able to identify who and who has it or the symptoms, and then we should be able to attend to them as appropriate.
Dr. Okechukwu, the NCDC still insists that tests will be done for those showing symptoms and not for the asymptomatic cases. Don't you think that this also poses a problem?
For the testing issue, ideally everybody should be tested. As it is now, we are having some level of community transmission. The cases we have initially were imported cases, but we've seen some that didn't have any history of travel out of Nigeria. They are coming down with the disease. And some cases that we are testing now that became positive were contact of the infected patients. So ideally, we should adhere to the criteria for testing. But as it is now, once we start having community transmission, then we should expand our services to every other person that needs it, especially people that are having one symptom or the other that are related to COVID-19. Recently, WHO had made it known to us that COVID-19 is airborne. That means anybody can get it. So you don't have to travel out of this country to get it. For us now in the medical sector, it would be better if actually we want to curb these cases and make sure that everybody stays free of COVID-19 infection. These testing services should be expanded to everybody. When you test the general populace, you'll be able to triage and then bring out people that are infected and get them treated. So NCDC should look at expanding the criteria for testing and then expanding the laboratory services. We are having challenge now because the laboratory services are very few when you consider the population that they need to cover. That is what informed that criteria in terms of selection. If we can go beyond what we have now to make the service available to everybody, then we should be able to test a lot of people, and then we should be able to identify who and who has COVID-19 and get them treated. The transmission will be limited to some extent, and we'll be able to overcome it. That means we need more testing facilities. The Gadwa lab that is in Apo serves virtually the whole northern state, which is grossly inadequate, and it's been overwhelmed by samples. This human resources is a problem too, so we need to look at areas where we can get more testing services into the country so that as much people that want to get tested should get tested.
All right, we'd like to appreciate your time, Dr. Josephine Okechukwu, Director of Public Health Department in the Federal Capital Territory. Thank you for joining us on the program.
Thank you.
Let's go over to Edo State, where it appears that some people are not paying attention to the call for social distancing. Now, the video you see there is a large crowd on the new Lagos Road, close to the new Benin Market in Benin City, the Edo State capital. The traders you see are buying and selling very close range, despite the call from the state government warning residents not to flout the government's regulations regarding containing the COVID-19 pandemic. And some of those restrictions have been the ban of more than 12 persons, the need for social distancing for at least 1 meter, and that all businesses remain closed. Our correspondent Jessica Olugbuchere tried to find out from some of the traders why they appear adamant. We had earlier spoken to the Deputy Governor of Edo State, Mr. Philip Shaibu, who was reacting to some of the measures the state government has taken to curb the spread of COVID-19.
And we have to go from the angle of being public awareness and appealing to our people. We're trying to be careful not to use force, because we discovered that force will not be the order of the day at this time, but to appeal. We had a meeting this morning with Mr. Governor and the task force, and we have asked the security agency to enforce the partial lockdown in Edo State. Only essential commodities stores should be open, and that we agreed this morning that the law enforcement agencies should enforce. We are distributing our sanitizer through the local government and to various palaces, and we have insisted that these sanitizers are free. We have no record of any of them that have been reported to us to be selling. And if we do know, obviously we'll be arrested. So those are just social media discussion.
Well, the Ministry of Foreign Affairs has directed all its missions abroad to compile the lists of willing nationals who want to come back home in the wake of the coronavirus pandemic. According to the chairman, CEO of Nigerians in Diaspora Commission, Honorable Abike Dabirewa, interested Nigerians are advised to inform the missions in the various countries they're in. She, however, said that the Ministry of Foreign Affairs has instructed that the financial implications will be borne by the prospective evacuees, who will be compulsorily quarantined when they return. She noted that while embassies in several countries are also on lockdown, those interested could go online, fill a form provided on the Commission's website, that is nidcom.gov.ng, nidcom.gov.ng. Still to come on our COVID-19 updates, the White House expected to advise Americans in coronavirus hotspots to wear masks to help stop the spread of the virus. You join us again. And to Lagos State, where the Commissioner of Health, Professor Akuma, has been reviewing the progress of curbing the spread of COVID-19 in the state. According to him, only patients with mild to moderate cases are being treated in isolation centers, and 4 more patients have been discharged in the state.
We are looking to open the Bagada Isolation Hospital next week. And we're also looking to commission the Onikon tent at the Onikon Stadium next week. So that will bring into commission 2 more isolation facilities, which will give us a total bed space, isolation bed space of about 300. And we're testing between 200 and 300 tests a day. So we're ramping up capacity across the board. The impact of social distancing plus our contact tracing and isolation of positive cases seems to be slowing down the steep of the curve. In other words, we are achieving some degree of bending the curve or flattening the curve. Our mathematical model, if we had not carried out any of these 2 interventions, would have shown a very steep rise in cases. But right now, we're averaging between 6 and sometimes 10 and sometimes 15 cases per day.
In the meantime, the Lagos State Governor, Mr. Babajide Sanwo-Olu, and his wife, Dr. Ibijoke Sanwo-Olu, have tested negative for COVID-19. The state's Commissioner for Health, Professor Abayomi, announced this on his official Twitter account under his hashtag COVID-19 Lagos update tweet in the early hours of today. Professor Abayomi also revealed that personal aides of the governor and the First Lady who tested for the coronavirus are all negative. Commissioner of Health also thanked Lagosians for their support and show of understanding this period. Well, joining us now to dissect the coronavirus pandemic in Nigeria is a public health physician, Dr. Akuma. Thank you for joining us again.
Thank you for having me.
All right, rather interesting, the briefings we've seen from the Presidential Task Force and, of course, the Lagos State Commissioner for Health. And he said something, talking about the Professor Abayomi, on the status Lagos is getting to, achieving some degree of flattening the curve, he says. And he said that Lagos is also averaging between 6, sometimes 10. He also said sometimes 15 cases per day. Do you think that this is really good news?
Just like the commissioner said, we've been having an average of 6 to 15 cases per day, which is actually good because we're seeing some form of flattening in the curve. But we would also have to wait until when we have all patients tested and after the containment exercise. Yeah.
So
before we could actually say precisely. But for now, what we're saying is a flattening of the curve, which is a good thing.
So can we actually say that the worst is really over and that maybe we have another 14 days or rather another 7 days if we're looking at the 14 days directive for the lockdown in Lagos, Ogun and the FCT?
Yeah, you can't say that completely that because the situation is evolving. So as the situation evolves, then we'll begin to know if that is the case. But for now, we're still doing contact tracing, we're still investigating, and we're still isolating. So for now, we can't say that.
Explain some of the symptoms and how one can differentiate a symptom on COVID-19 from perhaps a common flu or cold.
Yeah, so for the common flu, and the COVID-19, they all upper respiratory infections, but you have more severity with COVID-19. So while both of them, the similarity, you have chills, fever, headaches, and cough. For the COVID-19, you find some level of severity or moderate severity in elderly, and then some age groups who have underlying illnesses. Also, for the COVID-19, you do not have runny nose or sinus congestion. So that is the difference between the symptoms.
True. Tell us some more about perhaps the policy on mask wearing. We hear the US might be saying it will be compulsory for everyone to wear masks now. We hear several other countries talking about the benefits of actually wearing masks and not just for healthcare workers.
Yeah, in countries that have successfully contained the virus, yes, mask wearing actually helped. And that is because for patients who are asymptomatic, they do not have cough, they don't have any respiratory infection that is visible, but they spread this virus through talking or even through breathing. So yes, people wearing masks could help, but they have to understand that the public wearing the mask would actually affect the health workers, because right now the people who really need this thing, because we have a shortage in supply. So you have to consider that the health workers need this actually to do their jobs, and then people who are sick, so they use that so that they can prevent the spread of the virus.
All right, I'd like to appreciate your time, Dr. Akuma.
Thank you.
Thank you so much for joining us on the program.
Thank you.
While the coronavirus pandemic continues to rock the world, it's also pushing countries to the limit. The White House is expected to advise Americans in coronavirus hotspots to wear cloth masks or scarves in public places, and this is to help the virus spread. Back in February, China built an emergency 1,000-bed hospital in just 10 days. Now, the UK has built a 4,000-bed hospital in 9 days. Meanwhile, as the number of cases globally rises and deaths continue as well, in Britain, the Queen is expected to address the nation in a televised speech on Sunday. Well, let's look at the live feed of the World Health Organization website as each moment regular updates about the spread of the pandemic. Apart from the number of cases, deaths, recovery efforts also across board. You have frequently asked questions. There's several advisories there and all concerning the pandemic at your fingertips. It's a daily update, 30 minutes, and the next one comes your way at 9 p.m. That will be a 45-minute update. Thank you for watching. Keep watching Channels Television, your home for the news. I'm Millicent Nwaka. Bye for now.